So we're going to talk about Vincristine. As you probably know, if you have the interest to be Googling or searching for this. It's a chemotherapy drug that most of the time causes peripheral neuropathy, and we're going to talk a little bit more about that. I am Dr. Mark Rutherford. I am a chiropractic physician, 36 years, but I'm also a certified functional medicine practitioner here in the state of Nevada. This is
Dr. Reno. I'm a chiropractor and also a board-certified chiropractic neurologist.
And our backgrounds have allowed us to put together a clinic that has kind of evolved into an overall chronic pain clinic. Our background in functional neurology, which means brain and nervous system. Dr. Gates is well versed in the brain and nervous system. And functional medicine. I am not a medical doctor. We do work in an integrated environment, but I am not a medical doctor. So it's called functional medicine. That's what I'm certified in. That can tend to allow us to be able to be conversant in pretty much most of the systems of the body, the GI system, the cardiovascular, in a non-drug way. So between the two of us, and between our chiropractic background, particularly for peripheral neuropathy, it gives us the ability to evaluate the 3 different areas that can be contributing, or one of the 80 different contributors to people who have peripheral neuropathy. And the peripheral neuropathy that we're going to be talking about currently is going to be a chemo-induced peripheral neuropathy. And our practice has kind of inadvertently morphed into a practice in which we see a lot of peripheral neuropathy. So what we're here to do is share with you what we've seen, because as Dr. Gates has shared with me, and as I have heard in many of our consultations in which we're doing kind of a triage to determine whether a patient would be a good candidate for our types of services, we hear a lot that the patient has taken chemotherapy, they have had Vincristine, they've been told the peripheral neuropathy was caused by the medication, by the drug. I'm informed it's a very, very powerful drug, and then it may come back in 2 years, and that it may not come back in 2 years. Dr. Gates does the lion's share of the treatment here, particularly in all of our neuropathy and all of our neurological cases, and so he's had the opportunity to observe response and help to create some protocols that have been very successful in a lot of these cases, but I'm going to defer to him to discuss more of the specifics relative to the Vincristine caused peripheral neuropathies.
Beautiful. So as many of you know, Vincristine comes from the periwinkle plant, and it's a powerful agent that is used to treat certain types of cancers, non-Hodgkin's lymphoma, things of that nature. And unfortunately, basically, everybody will get peripheral neuropathy who takes Vincristine if you take it long enough. And many times, oncologists will tell you, as Dr. Rutherford alluded to. Okay, yeah, I'll go to that. And as Dr. Rutherford alluded to, basically, most oncologists will say, within 2 years, your peripheral neuropathy symptoms should reside, and that happens 80% of the time. 20% of you, however, will be kind of stuck with the peripheral neuropathy long term if you developed it.
And to my understanding, we don't know why that 20%.
We really don't know why. Basically, the Vincristine causes the architecture of the nerves to degenerate. They're called microtubules, and they're involved in transporting certain types of nutrients and chemicals up and down the nerve, and once they break down, it's like the freeway is broken open and you can't drive down the highway. So we don't really know why certain patients don't get better out of those 20% naturally with going off the Vincristine. However, with our chemotherapy-induced peripheral neuropathy patients, what we look for is that we do a trial stimulation where we go and we basically try to breathe the nerves back to life, kind of like jump starting a heart back into life. And we've seen some really neat responses with that approach. We've also seen where it doesn't work as well. And so we try to make a decision usually on the first day, is this person going to do okay with what we do or not going to do okay? And we address this thoroughly in our book that we're writing on peripheral neuropathy, that there are studies out there which show you can shock the nerves back into life. And lots of times those responses are short-lived, because if someone has something like diabetes, the diabetes is going to perpetually attack the nerves causing them to die. However, you're in a different category, because with the chemotherapy-induced peripheral neuropathies, once you're off the chemo, will those nerves come back? We do use certain metabolic treatments, so to speak, to help the nerves come back. We try to decrease inflammation in the system. We do certain types of nutritional protocols. But with all that being said, we've seen some positive results, we've seen some not so positive results, but usually we'll know. And so that's our data on Vincristine neuropathy. I could bore you with details relative to physical exam findings and things of that nature that we don't need to get into, but that's kind of the
So really the
story.
key is if it's not coming back, I wouldn't wait 2 years. Okay, my observation in doing the triage or doing the patient selection consultations is usually if it's been 6 months and you see no change, I think there's a good chance you're not going to be seeing a lot of change. That's just been my experience of listening to histories over histories over histories. There's potential for you to come back. In the beginning, I stated, well, they don't really know why the 20% doesn't get better. I would have to believe that because they are probably have other vulnerabilities that may possibly make them more receptive. Dr. Gates talked about inflammation, autoimmunities, maybe one of them, and they may not be, okay, and they may not be. But the bottom line is we actually have there are several different types of stimulations that could be used. We use laser in these? Mm-hmm. Yeah, there are several different stimulations that can be used. There's a laser that can be used. Dr. Gates, based on his examination, generally, as a chiropractic functional neurologist, generally will determine which one of those stimulations seems to be most appropriate in that particular case, in those particular nerve fibers. And then you can kind of know in the beginning whether you would respond or not. And so that's what we know about Vincristine-induced chemotherapy. Is there anything you'd like to add?
I'll just interject. You mentioned functional neurology. So basically, as board-certified chiropractic neurologists are referred to as functional neurologists because we don't use medications. We do things functionally to bring back nerve function or brain function. So that's the only thing I'd say there. And otherwise, I think that's pretty concise on Vincristine neuropathy.
Okay. If you have any questions, if you have Vincristine-induced chemotherapy, this is just a little capsule to try to give you a background, try to give you a little bit overall view of what you might be looking at. And but if you have any specific questions, please feel free to contact us at powerhealthtalk.com and or our Facebook page. Mm-hmm. And then you want to talk about the peripheral we just found out before we were doing this.
www.peripheralneuropathygroup.com is up.
We're talking about
we're building it. Our producer Kevin is building it. Day by day, we're having the videos transcribed, so patients who like to read or who have audiological disorders can read what we're talking about.
And so we've done hours on peripheral neuropathy because it's such a big part of our practice. So all the things we've done are ultimately going to end up on that site.
Yeah, exactly.
So if you want to be like the ultimate expert on peripheral neuropathy, that'll give you a good head start.
We'll have a lot of videos up there.
Okay.
Well, thank you for watching.
All right.